The ENC protocol is a step-by-step guide for health workers and medical practitioners issued by the Department of Health for implementation under AO 2009-0025, dated December 1, 2009. Before starting the delivery, place a linen at the top of the mother's abdomen. After that, be ready to instruct the mother to inhale, exhale, and push. Inhale, exhale, and push. After delivering the baby, the nurse should call out the time of birth. Next is to dry the baby for at least 30 seconds. After drying, wipe the head down to the lower extremities of the baby. Remove the wet cloth and do a quick check for breathing. Next is place the baby in skin-to-skin contact with the mother. The baby should be prone in the mother's chest in between the breasts with the head facing one side. After that, place a clean, warm linen at the back of the baby. And put the cup in the baby's head. The purpose of this is to warm the baby and prevent hypothermia. Next is to clean the mother by applying the perineal care. Also check for the uterus if it's contracted. Next is to administer oxytocin by intramuscular to the mother. The purpose of this oxytocin is to stimulate powerful contraction to help maintain and open the cervix, which help push the placenta and limit the bleeding. Check for the baby's breathing and also check the mother if she's comfortable. First step in cold care is removing the first set of gloves to prevent cross-contamination. Check the umbilical pulsation. If the pulsation stops, clamp the cord using sterile plastic clamp 2 cm from the umbilical base and clamp again 5 cm from the base. After that, cut the cord to the plastic clamp. Make sure to cut the cord at the first clamp. Take note, do not milk the cord towards the baby. After the first clamp, you may strip the cord of blood before applying the second clamp and then cut the cord to this 2 cm plastic clamp. so that there's no need for the second ring. Do not apply any substance into the clump. Next step is wait for the powerful contraction until the placenta expels. After expelling the placenta, check for the completeness of it. Then identify the placenta. Take note, the placenta can help identify if the baby is healthy. Unang yakap. Unang yakap or breastfeeding. This is done in 15 minutes to 90 minutes. It is conducted for breastfeeding initiation. Take note, the earlier the baby breastfeeds, the lesser the risk of death. While maintaining the skin-to-skin contact, advise the mother for feeding cues such as tonguing, licking, and rotting. Support the mother and instruct her in positioning while breastfeeding. The purpose of skin-to-skin contact is for mother and baby bonding. Wait for full breastfeed to be completed. After completing breastfeed, administer tetracycline ointment. The purpose of this ointment is to prevent neonatal conjunctivitis or pink eye. Do a thorough physical examination to the baby to know the general status of baby's health. This also gives you the time to talk to the mother about the baby's problem. Next is administer vitamin K to provide protection against bleeding due to lack of this essential vitamin. Then, administer hepatitis B shot. Lastly, is to administer BCG intradermally. This is given to the baby to protect them from risk of tuberculosis. Advise mother for optional delayed bath because early bathing can lead to hypothermia, infection, coagulation, defect, acidosis, and even hemorrhage. The first hour, check for the baby's breathing and color. Also check for the mother's vital signs and massage uterus every 15 minutes. Lastly, complete all the records. This record can be used to ethical and legal purposes.